Good morning, friends. Today we are discussing about interesting topics hypnotherapy. Now, Dr. Asutosh will read this book chapter from my book.
The chapter Hypnotherapy has been written by Dr. Manu Parmar sir in his book Jivan Sanhita. Now we are going in details. The hypnotherapy chapter was delivered by Dr. Manu Parmar sir at Daman for postgraduate psychiatric resident by Indian Psychiatric Society. Introduction. The word hypnotism generally provokes a picture of magician in our mind who pretends to use some strange power within himself to demonstrate that the hypnotized person start following every command. He seems unable to bend a straightened arm and sniff a bottle of ammonia with obvious expression of delight. As he has been told the odor that was of rose, he remained relaxed and comfortable despite applications of a painful stimulus, or he is regressed back to the age of 6 months and made to snuckle a milk bottle. This type of stage performance, just for fun and entertainment, pretends by some irresponsible and unauthorized person, have done a profound disservice in the more valuable therapeutic use of the science. That not only cause severe damage to the participant on the stage but also spread many misconceptions and prejudice in the society. Generally, it is believed that people with weak mind and poor intelligence can be put to hypnosis easily, or that hypnotist is endowed with a supernatural power, or that he used some magic or mantra to bring the hypnotized person under his command, and that the poor individual under hypnosis would do anything and everything the hypnotist instruct him to do just passively. In fact, more than 90% of the population is hypnotizable. Ability to undergo hypnosis is a quality or positive aspect of one's mind or intelligence. Of course, it is with any other capability, everyone cannot attain the same degree of hypnosis. It has been established now that more intelligent and cooperative individuals with strange willpower and better imaginative involvement can reach a deeper level of hypnosis very easily. Hypnosis is not a magic, neither a supernatural power nor a mantra is used by hypnotist. Willingness of a person to undergo hypnosis is essential. Even under a deep state of hypnosis, a person remains endowed with sufficient power of self-defense. He does not do anything that is against the moral or personal belief and not disclose any of the secret of his life which he could not wish to tell. History of hypnosis. Modern hypnosis originated with the Australian physician Anton Mesmer 1734 to 1815, who believed the phenomenon known as mesmerization to be the result of animal magnetism or invisible fluid that passes between the subject and the hypnotist. The term hypnosis originated in the 1840s with the Scottish physician James Braid 1795 to 1860, who believed the subject to be a particular state of sleep. Hypnos is the Greek word for sleep. In the late 19th century, the French neurologist Jean-Martin Charcot 1825 to 1893 thought hypnotism to be a special physiological state, and his contemporary Branham 1840 to 1919 believed it to be a psychological state of heightened suggestibility. Sigmund Freud, who studied with Charcot, used hypnosis early in his career to help patients recover repressed memories. He noted that patients would relive a traumatic event while under hypnosis, a process known as aberration. Freud later replaced hypnosis with the technique of free association. Milton Erickson, a pioneer in the field of clinical hypnotic induction, says that every period in which individuality can flourish. Today, hypnosis is a method that is used as a form of therapy, hypnotherapy, a method of investigation to recover lost memories and a research tool. At present, hypnosis is being recognized as a legitimate form of treatment method by British Medical Council, the American Medical Association, and the Medical Council of many other countries like Canada, Australia, Sweden, Japan, and so on. The last 3 decades have been development of serious interest in the systematic scientific research in the field of hypnosis all over the world. This has resulted in the formation of a strong and viable international society of hypnosis with 25 national societies as its constituent societies, including the Indian Society of Clinical and Experimental Hypnosis, established in 1972. Hypnosis has now been included in many of the medical school curriculum in England, America and continental Europe. In 1952, a British Act of Parliament was passed, Hypnosis Act 1952, and clause to one bracket state, no person shall give an exhibition, demonstration or performance of hypnosis on any living person at or in connection with an entertainment to which the public are admitted, whether on payment or otherwise, unless the controlling authority have authorized the exhibition, demonstration or performance. This act was aimed at limiting the public exhibition of hypnotism as an entertainment for the scientific or research purpose or the treatment of mental or physical disease. Nothing in the act shall present the exhibition, demonstration or performance of hypnotism. Definition: hypnosis is a complex mental phenomena that has been defined as a state of heightened focal concentration and receptivity to the suggestion of another person. It has also been called trance state, an altered state of consciousness, a dissociated state, and a stage of repression. Martin Orne defined hypnosis as that state or conditions in which a person is able to respond to appropriate suggestions by experiencing alteration of perception, memory, or mood. The essential features of hypnosis is the subjective experimental changes and time distortion may occur. Hypnotizability: the capacity of an individual to be hypnotized, for which therapist can use a number of specific procedures to help the patient by hypnotized and respond to suggestion. Charcoal pendulum test and eye roll sign test widely used to check hypnotizability. Trance state: person under hypnosis are said to be in a trance state, which may be light, medium or deep. In a light trance, there are chances in motor activity, changes in the motor activity such that the person's muscles can feel relaxed, the hand can levitate and paresthesia can be induced. A medium trance is characterized by diminished pain sensation and partial or complete amnesia. A deep trance is associated with visual or auditory experience and deep anesthesia. Time distortion occurs at all trance level but is most profound in the deep trance. Post-hypnotic suggestion is characterized by the person being instructed to perform a simple act or to experience a particular sensation after awakening from the trance state. It may be used to give a bad taste of cigarette or a particular food, thus aiding in the treatment of nicotine dependence or obesity. Post-hypnotic suggestions are associated with deep trance state. Indications: hypnosis has been used with varying degree of success to control obesity and substance-related disorder such as alcohol abuse and nicotine dependence. It has been used to induce anesthesia and major surgery has been performed with no anesthetic agent. It has also been used to manage chronic pain disorder, asthma, local pruritus, aphonia and conversion disorder, nocturnal enuresis, anxiety disorder, phobiasis, insomnia, and used to induce relaxation in systematic desensitization, also used in the following condition: psychosomatic disorders, psychosexual problem, behavior modification, stuttering, learning disability, communication disorder, painless labor, psychological impotence, for excellent study, memory, concentration and exam performance, personality development, ego strengthening and self-actualization. Contraindications are dependent personality, paranoid person, mental retardation and OCD. A secure ethical value system is important to hypnotherapy. Future of hypnosis: meets new challenges, crime and law enforcement, criminal investigations, sport achievements, children upliftment, de-addiction purpose. Hypnosis induced method: a variety of methods which you can use to develop a hypnotic trance. These are examples of techniques which you can change and adapt for your own use in practice. There are hundreds of varieties of trance technique, but the one present here are varied and effective. Progressive muscle relaxation, the indirect language method, the direct language method, eye fixation method, guided imaginary technique, using dream technique, Milton Erickson handshake technique, deepening hypnosis by music, instrumental such as somnoscope, hypnotic balls, the placebo technique, The auxiliary hypnotist confusion technique, narco hypnosis last resort. Specialized techniques are: first, age regression. You will guide the subject backward into the warehouse of memories used to uncover hidden material and for other recall. Second, time progression. A preview of coming events. Take a look into future possibilities used in surgery rehearsal and in self-imaginary. Automatic writing. Third, automatic writing, a dependable method to tap the subconscious for information, bypass the ego and the unknown which resist opening up. Fourth, group hypnotherapy, how to conduct hypnosis with a group of people who have various problems, group regression and progression. Fifth, prolonged trance therapy, when all has failed, the subject is kept under hypnosis for several hours or even days, used in drug addiction cases. 6. Indirect hypnosis. Inducing hypnosis without the knowledge of the subject requires a special skill suggested for medical use only. Practical protocol. When you want to hypnotize a person, select peaceful environment, time and place, and see that the chair or couch used in a comfortable one, and make sure that his cloth and ornament do not resist the free movement. The light should be semi-dark room. The subject should be empty stomach but desire to drink fresh water. Let him have it or allow bathroom also. Position may be sitting or reclining, and time spending in process at least 1 hour. Ask the subject to close his eyes and pay attention to your voice and imagine according to your suggestion during the course of the session. Coordination and cooperative between the hypnotist and the subject is necessary. The manner in which you give suggestion is very important. Use a quiet but husky tone of voice which leaves no doubt about you are fully confident and know what you are doing. Never make uneasy pause, and what are you saying should flow smoothly and easily. It is wiser to put in writing or memorize in phrases. You should clarify first any doubt or any fear that the subject have in regard to the science of hypnosis before you start induction. Explaining the merits and benefits that the subject would gain after the therapy to enjoy the state. The following procedure is advised to hypnotize your subject. Close your eyes and listen to my voice attentively and proceed in the following manner. Relax, relax and relax. You are going to experience a wonderful state of relaxation. Everything will be smooth and easy. Make yourself as comfortable as possible. Relax your hand. Relax your legs. Relax your entire body. Remove all other thought from mind and continue to listen to the suggestion attentively and visualizing accordingly. Now take 5 to 10 deep breaths that will make you relax more and more. Relax your hands, relax your legs, relax your entire body. Now imagine that your legs are getting relaxed. Now imagine that your hands are getting relaxed. Now imagine that your entire body is getting relaxed. Now imagine that your legs are getting more and more relaxed. Now imagine that your hands are getting more and more relaxed. Now imagine that your entire body is getting relaxed more and more. Now imagine that your hands are getting heavy. Now imagine that your legs are getting heavy. Now imagine that your body are getting heavy. Now imagine that your eyelids are becoming heavy. Now imagine that your eyelids are very heavy. Now you can not open your eyes. The more you try, the more difficult it becomes. Now you are slowly going into deep sleep. You are very sleepy, very sleepy, very sleepy. Now I am going to count the numbers from 1 to 10. With every count, you feel very sleepy and you will going into deep sleep. By the time I reach number 10, you will be in deep, sound and pleasant sleep. 1. Slowly you are going into sleep. 2. Slowly and steadily you are going into sleep. 3. Now you are enjoying wonderful sleep. Your body is completely heavy and completely relaxed. 4. You are going to deeper and deeper sleep. 5. Now you are still going into deeper and deeper sleep. Repeat 6, 7, 8, 9 and 10. By this time, the person will be in deep hypnotic sleep and you can give him necessary suggestion prescribed to improve his health and etc. Termination of sleep. You have wonderfully enjoyed the relaxation, heaviness and hypnotic sleep. Now you are coming back to the normal conditions. I shall count from number from 5 to 1. By the time I call number 1, you will totally come out of the trance and feel very fresh. You feel fresh, very energetic and very enthusiastic. 5. Slowly the heaviness of your body disappear. 4. Slowly you are coming out of the sleep. 3. The heaviness of your body has totally disappeared. 2. You have totally come out of the sleep. 1. You are very fresh. Open your eyes. Take 3 to 5 deep breaths. No patient should have left the consulting room without failing of will, being and hope. Thank you.
Thank you, Dr. Asutosh. Nicely related this topic.
Thank you.